Good morning, everyone. Welcome to day 3 of our Aim for Zero Suicides conference. I'm Jenna Heiss. I'm the Director of Implementation for Suicide Prevention at the Office of Mental Health, our Suicide Prevention Center. And I'm very happy to be here with you for our final day of our symposium. Today, we are going to be starting out with some opening remarks and comments and recognizing some of our wonderful partners. So I'm just going to start with our housekeeping announcements and remind everybody that we do have continuing education and CMEs for some of our sessions. So please just take a note on the main agenda of which sessions have those to offer. When you fill out your main evaluation that gets mailed to you after this event, excuse me, then you'll be able to be counted for those, and we'll count your attendance during this time, and you'll be able to get those. And also, just know that at the very end of this closing for today, we'll be talking about some exciting opportunities to be able to move this zero suicide framework forward in your agencies if that is of interest to you, if you're inspired as I have been during this time. We also have our resource page that we ask if you're interested to take a look at, and don't forget you have the opportunity to download all these presentations into your takeaway bag, we're calling it. And again, just very excited to have you here. Your moderators will be in all of your sessions, moderating the chat, and you can ask any questions that you have at those times. So without any further talking from me, I will turn it over to our director, Dr. Jay Carruthers.
Good morning, everyone. Boy, welcome to day 3. I really hope you all have gotten a chance to at least catch some of the content from the first 2 days. I mean, wow. Just when I thought it wasn't really possible to top the content on day 1. Yesterday, we had Dr. Ed Coffey, Dr. Ed Boudreau, Dr. Ed Coffey from who's really kind of one of the pioneering forces at his work with the defect-free depression care project at the Henry Ford Health System. Dr. Ed Boudreau, who's really been doing cutting edge work, screening in emergency rooms, and former Commissioner Mike Hogan. Really strong first day, and followed, but yesterday, I don't know, might have even topped those 3 gentlemen. And as we got into sort of equity and cultural competency related zero suicide, and it was really just fantastic. So that content's available. It will be posted. I think we're going to have it up for 30 days on the site. You can go back and I know I'm going to go back and re-listen to some of them. It was just that good. So, but thank you for joining us for day 3. We've really got internationally recognized people coming in today as well. So just to pick up where we left off, starting with David Covington, who's really one of the founding figures, and many of you may know, he brings incredible energy and intellect to the work, and is going to be talking about crisis care. Obviously, there's a lot of enthusiasm around reforming the American crisis care system, behavioral health care crisis system, that's being in part galvanized by 988, and with all sorts of opportunities to address equity and criminal justice diversion. So that's going to be a real treat. David's got our keynote, and we'll be starting after at 9 a.m. Then we're really lucky to have Dr. Richard McKeon, who brings the national perspective. He's the chief of the Suicide Prevention Division at SAMHSA, and has been at that position for years, and really has been such a strong advocate for suicide prevention across the nation. Brian Amadani from the Henry Ford Health System has really been really advanced the literature around the seventh domain of improve in zero suicide, in the framework of zero suicide, really bringing a data-driven approach to everything that they do at the Henry Ford Health System. So we hope you can tune in for all three of those. Again, they'll be posted, and the recorded session will be posted. All right, but this morning we're going to devote some time to really those that have been doing tremendous work here in New York State. I think everyone can appreciate that this is really hard work. I think the expression people have kept on hearing is not for the faint of heart, but I do think it's really crucial to acknowledge those putting in the work. Dr. Boudreau gave a fantastic talk on Tuesday, screening in EDs, including something called, he educated us on something called computer adaptive testing, a very powerful tool that's shown great promise in pediatric emergency rooms, and that can really accurately predict who's going to go on to have an attempt with 80% accuracy over the next 90 days. But he said, I guess there's an expression in computer science that, these are technology is a powerful tool, but you got to keep a human in the loop. And I love that expression. I think at the essence, this is suicide prevention. We need to keep humans at the loop. And we're going to, I'm going to acknowledge some of the humans that have been in the loop here in New York State that have been doing fantastic work. So we're going to start with some of our, well, there are two groups that we're honoring here. So one is from the New York State Suicide Prevention Council. We have 4 work groups that are devoted to, one is the healthcare group or zero suicide group. Another is youth in schools. The third is community and coalitions. The fourth is sort of data and surveillance. So I wanted to start by honoring some of those folks, as well as some of our grant sites that are participating in our zero suicide grant, which is a 5-year grant from SAMHSA. We are actually just entering into our 5th and final year of that grant. And we've had some really, these are, today's session is really, the theme of today's session is going from good to great. And the grant sites are really modeling that behavior, doing the hard work. So I'd like to take a few minutes just to honor them. And so important to do in this work. So I'm going to share my screen here. So I want to start with a friend and colleague. Let's see here. Dr. Verna Little. And I hope you saw her presentation yesterday. It was really just, world-class presentation on suicide prevention within primary care. She's an absolute subject matter expert in this area, but she's also chairing our zero suicide work group on the advisory, and so she's accepting on behalf of that whole group, and I think she's attending this morning as well. So want to thank you, Verna, and the rest of the members of that. And just to say a little bit more about the council. It's not just an advisory group. These are really, these individuals have been selected because they're effective and they get things done. So I think that's really important to underscore. It's not simply just kind of plugging into a meeting quarterly. It's actively trying to support implementation of the New York State Suicide Prevention Plan and advance the cause. So there's been a tremendous amount of work in this area for zero suicide, integrating, systematically integrating suicide prevention into healthcare across New York State. So I want to thank Verna and the rest of the work group at the council there. I'm going to shift on to the community and coalitions, where Melanie Verity is is listening to this morning and representing that work group. Also done a tremendous amount of work. Mel is she's the senior director of the Eastern Division of the American Foundation for Suicide Prevention. Some of you may know that we have coalitions across the county suicide prevention coalitions. Gara Lloyd Lester is a staff person on my team that facilitates that with Mel and the rest of the members. So I want to thank them for all their ongoing work. Next, I'd like to acknowledge all the work, the tremendous work that's being done in the Youth in Schools work group, and accepting that our award is really Mitch Samet, who's chaired that work. Mitch is co-chair of the suicide prevention work group for the New York Association of School Psychologists, and Pat Brew is the staff person that's been facilitating that work group. They've really been, as they say, cooking with gas and doing a tremendous amount of work trying to implement some of the recommendations that have come out of various task force groups across the state. So really doing a tremendous amount of work. So thank you, Mitch, and the rest of and Pat, and the rest of the work group members there, including a subgroup that's doing a lot of work for LGBTQ related suicide prevention. Okay, and the fourth and final group is the data work group, and so I sit on that work group and facilitate it along, Katie Comer as well on our team helps with that. But there are several members, mostly sort of government types, that don't get the recognition they deserve, but so critical. I think obviously it's a low base rate phenomenon, statistically rare, but shockingly common, as we say, and critical that we have really the best possible information, so accurate and can identify trends like the alarming trends that we're seeing with increases among Black youth, so that we can and also determine impact. So I want to thank everyone that's been working hard in that group. Okay, so on to kind of our grant partners. So as I said before, these are really folks that are in the trenches working hard every day to try to go from good to great. So I want to, first we're going to start with Bronx Care. And Bronx Care obviously is in the Bronx and is a large health system for those that are not familiar with it. And I want to acknowledge Nicole Miller, who's program administrator for mobile crisis, CPEP, and inpatient psychiatry, along with Dr. Shaw and Andreas Evidakis. They've really been deeply committed to this from the very beginning of the grant, and representing New York City and New York State in exemplary fashion. So I want to thank everyone at Bronx Care. Now we're moving into central New York, where we're doing a really intensive demonstration project, and many of our sites are located there. So CerCare is represented by Sarah Polini, Clinical Director, Outpatient Behavioral Health, as well as Rosanna Sohan, Practice Manager, Outpatient Behavioral Health. And really, CerCare has just been kind of a poster child for zero suicide. They've participated in the Psyche's CQI project, really the largest zero suicide demonstration in the nation, with close to 160 Article 31 OMH licensed clinics, and has continued to really, they haven't rested on their laurels as participating in our grant, and continues to try to really set the bar high. So thank you for all the hard work. And then on to Contact Community Services. So Contact is represented by Pat Leone, Executive Director, as well as Cheryl Giarusso, Division Director for Crisis Services. What a team they have, and really just anchoring crisis services in they're the local Lifeline affiliate and been really engaged in this work, seeking grants on their own and also participating in some of those that we've gotten at New York State. Just a deep, deep commitment to this work, and it's been a pleasure working with them. Crouse Health, also in Syracuse. So Crouse is represented by Catherine DeShaw, manager of the outpatient treatment program and outpatient services. So Monica Taylor as well. Really, they've been really providing leadership and, integrating suicide prevention in SUD settings, such a critical place to bring zero suicide. We know that they're at increased risk. So thank you for all the hard work for those at Crouse. Continuing on to our another site in Syracuse, Helio Health, also doing fantastic work. Fyung Kripalani, Integrated Services Clinic Director, I believe is in the audience, and I want to acknowledge her ongoing commitment and the rest of her team. They've really been providing a lot of leadership in Central New York. Okay, next, Liberty Resources. Jennifer Fuller, Director of Integrated Healthcare, and Suzanne Bauer, Clinical Site Director of Integrated Healthcare, are, I believe, in the audience this morning. So thank you both. Liberty also has just been a fantastic partner in this work. So I want to thank them for their ongoing effort. St. Joseph's. So for those that don't know, St. Joseph's is a hospital system in Syracuse. They have a CPEP, a psychiatric emergency room. Jennifer Van Dyke is nurse manager at the CPEP. We want to acknowledge her efforts and the rest of the team at St. Joseph's. They've really been actively engaged in this, trying to leverage their EMR, make changes, really doing a lot of work in this area. So thank you to everyone at St. Joseph's. Samaritan Hospital down in Troy. Colleen Kennedy, Zero Suicide, who's the grant coordinator there, has been a fantastic partner. Rachel Handler, the executive director of behavioral health and services at Samaritan, and also on the council, on the Zero Suicide work group. Rachel's been just a really steady presence engaged in this. I want to thank you and everyone who's been doing the hard work at Samaritan. And then SUNY Upstate University, who's been really one of our stalwart kind of partners through this process. Anastasia Siddiq, grant coordinator, and of course, Dr. Sitha Ramanathan, medical director of the outpatient psychiatry, who has just been deeply committed to this work from the time she was at Hutchings, and now she's at Upstate leading the work there. So I want to thank everyone for their ongoing effort. Again, keeping to this theme of keeping humans in the loop. These are the humans that have been in the loop and really have been dedicating a lot of energy. This is not easy work. It's challenging, tough plotting work, and some days are harder than others. So I really want to thank everyone, our grant sites and the council, for their consistent and steady leadership and engagement in this area. All right. So let's see, we've got about 10 minutes left before our keynote speaker. And I hope you'll stay tuned. It's David Covington, who really is internationally known for his work. And I really hope all those that are listening, we'll have kind of a closing session, but we're going to be talking about this at the end of the day. But for those systems that are not currently engaged, we're very eager to move beyond grant sites and participate and develop additional partnerships, provide ongoing technical assistance. There's many ways to kind of get involved in this work. It's really quite rewarding work. and hope that folks will stick around and watch all the content today, and really carry some of this back to their organizations, and reach out to us. And we look forward to working with you in the future. I think that's really it for our session. I do want to thank particularly Jenna Heiss and my team for Kara Brzezinski, and the rest of the staff have worked really hard to put this symposium on. So just want to, while we're in the spirit of keeping humans in the loop, and those that have really been doing a tremendous amount of work to bring you this rich content, I wanted to acknowledge those folks as well. So, okay, so hope you have your cup of coffee and you're strapped in and ready for a high octane presentation from David Covington. Thanks for plugging in. And again, thanks for all your ongoing commitment and work in this area. Have a great day and hope to see you soon.